Okay, so we are at the end of our 2018 trip to Romania, and we're finishing off with a nice dinner at the Lebanese restaurant in the Phoenician Grand Hotel. It was very nice. Just in reflecting on this week, in terms of the big accomplishments, we were able to get the CEO of the hospital. I don't know if that's her actual title, but basically the physician who is in charge of the adult and children's hospital, she, as well as Dr. Tinka, Dr. Malancha, signed on to a collaborative agreement with the university, which we're going to have signed by Dr. Gerard, Dr. Samari. And so I think this just paves the way for this relationship. Number one, it's an official relationship now, and it will hopefully allow for medical students, graduate students, residents, and other faculty to be exchanged between the two institutions with a goal of improving medical care for both Americans and Romanians. As far as the rest of the week, from an orthopedic perspective, I already talked about some of the things I saw on my first day that I thought were very valuable. I got to see a number of pilon fractures. I got to see a number of hip fractures. I got to see a significant number of distal humerus fractures, more distal humerus fractures than I have seen in a week's span of time in my entire life. We did a complex surgery on a nun's elbow who had a bad non-union, malunion from a distal humerus fracture, and we'll see how she does with that. And we had a good discussion about potentially doing research on tibial plateau fractures, external fixators, patients that were tipperized with external fixators that go on to require internal fixation, and acetabular fractures, as well as distal humerus fractures. Memorable points of the weeks. I think every night of the week we had very good dinners, and I think some of the best time we had fellowshipping with the Malanches, the Tinkas, were at these dinners.
So I continue to reflect on this trip for the last week and continue to be so struck by their hospitality and all of these things that they had planned for us the whole week. It's hard to think that we could offer anything comparable in America, going out to a hunting lodge, traditional Romanian culture and masks and traditions, which was really great to be a part of. And they've just welcomed us so much into their culture and their lives. And even in the hospital, just allowing us to be a part of things from day one unabashedly. Never a question, said, "You're going to scrub this case, come on in," and made me feel welcome and a part of the team from the very beginning. And so that was great. The other thing that I notice here is it's really easy to be critical of other cultures' ways of treating medical problems, and even other hospitals in the United States and other physicians. But you realize that they have a different set of rules and a different set of equipment and availability of things that we have the luxury sometimes in the United States to have our pick of whatever we want. It'd be easy when you look at some of these hip fractures that don't get fixed for 2, 3, 5 a week at a time, as these elderly women and men lay in bed, which would never happen in America, but we have all the resources to take care of those things. And here they don't have the equipment to fix these fractures, and so they do the best they can, and they do great with the equipment that they have. I said to one of the surgeons that, if you sent an American surgeon here to deal with what they had, I think they would really struggle. And these guys make do with a lot less than we have and do a great job at it and give these patients good outcomes and give them the best fixation that they have available to them. And they get great reductions with plates that aren't even designed to do those types of things. And so I think it's easy to be critical of other people and other treatment strategies, but you come to a place where they don't have what we have, and I think it's just be mindful of that when you're looking at other societies and other cultures and the way they treat things. And then it's just been a great trip with all the people here that we've been with, getting to know one another, getting to know each other a lot better, and all of our capabilities and skills, and how we can all help not just here in Romania, but also back home to be better surgeons, nurses, surgical technicians, pediatricians by what we've learned here. and take a lot of what we've learned here back to help our patients do better. So I'm been grateful to be involved in this trip, and be one I'll never forget.
I feel like I've been very fortunate in my life to travel and see a number of different health systems, and this has really been a special experience for me, getting a chance to come to Romania and meet friends and get an insight into the strengths and exciting work that they're doing here in Romania. It's been curious to see how evidence-based practice is completed here in Romania, and the attention to European practice guidelines for routine conditions like asthma, pneumonia, viral URIs, and other community-acquired infections. The time that I spend as an IT nerd when I'm in the States, being able to see a record that carries from one institution to another around the country, around the entirety of Europe, something that I know that we are continuing trying to strive to. And I think the things that probably struck me more than anything, beyond the incredible warmth, intelligence, and skill of the Romanian physicians with whom I had the chance to work, was the communication that went on between the physicians and the patient team, the patients. The fact that the patients had access to the entirety of their medical record. The fact that any day a provider could complete a consult with a different specialty right then and there, and be able to have a closed loop referral process in that same day. The type of thing that when I am scrambling around trying to get people into some specialty appointments that may be 6 months, 1 year, maybe even more than that out, that I thought was pretty special. And the important camaraderie that kind of builds amongst the Romanian healthcare team, and being that close and be able to share that space together, I think is one of those things that's really, really exciting. And I think maybe part of that is Bodashan being a medium-sized hospital, but as I understand it, part of that is like the system that they have in place that provides a lot of access both to family doctors, primary care doctors, and then specialty providers. I think it's always interesting to know how our technical resources differ in different places of practice. We had an excellent discussion about how to manage complex seizures and other neurologic sequelae without a CT scan or advanced imaging. So like when you're so used to ordering a CT or an MRI or other more advanced tests, like when those aren't available immediately, how do you kind of adjust our practice? So for me, it's been an incredible week, and I can't second enough the incredible hospitality of some old Romanian friends, some new Romanian friends, and how exciting it's been to conceptualize their healthcare system and understand what kind of insights it provides to our own.
So coming into this, I never knew what to, or never know what to expect coming into this. Dr. Heddens invited me to experience Romania, see how they do stuff. They do so many cases like we do with, with limited resources, and they still end up with great outcomes to patients. And that really kind of got me thinking personally on how we do stuff and the number of trays we open. You know, this patient needs surgery, you know, can we just splint them and just kind of, you know, do some type of care for them. I'm not a doctor, of course, but, and on a personal note, from day one, as soon as we met them on off the airplane in the airport, they welcome us and make sure we had everything that we possibly wanted, from food to just everything, just instruments, whatever. Sometimes they didn't have the instruments we normally use, but they had different set of instruments that still the surgeons were able to use and accomplish and create great outcomes for the patient. I definitely like to thank Dr. Headings and everyone that came on the trip here for this opportunity. I'll definitely be part of it in the future.
All right, so like Angel said, going into this, I really had no idea what to expect. Dr. Headings kind of painted a picture of it being a wonderful experience, so I was sure that it would be nothing short of that. But from the second we got off the plane, it was just amazing to see the hospitality and the willingness to accept us by these families and friends. They treat us like family and open their hearts and their arms to us in their homes and the hospital, and really gave us a great picture of what their health system's like, the resources that they have, things that they need, and it was just great to see how they work together so well and how they just adapt to what they have and what they can make work and still give patients great outcomes. I hope to still be part of this in the future and come back and see how things continue to change for them and just continue working with them.
Okay, so I came into Romania with a completely open mind and with a sort of idea that a lot of the European continent is very hospitable and accepting, but all of my expectations were completely blown out of the waters by just how great these people are. They truly are the best, and I can see it in like the way they work in the medical field and how they interact, and also when they're just partying and drinking, they're still being great people. And Radu was incredibly hospitable to me when I was watching the surgeries, since I haven't seen surgeries before, and so one time I was not doing so good, or at least he thought I was not doing so good, but I thought I was fine. So he grabbed me, took me out, and he said, "Look, you look not so good. I can see it in your eyes. Trust me, I fainted 2 times in surgery." And so I didn't want to fight it, since it was such a genuine feeling or gesture. And so really I just like the people here. I like their culture and their kindness to each other. And also I really like the experience I've had to get out and try vlogging, and I think it's great for me.